Welcome back, folks. This is Dan Solloway, the host of the Health and Fitness Radio Show, and you're listening to News Talk 1520 KOKC. I'm going to talk about something I haven't ever talked about before, and I've been aware of it. I've known about the health benefits, but I was also concerned about the negative benefits of, well, I'll just say it what it is, marijuana. Marijuana is, you see it all over the news, you see it all over YouTube on a wide variety of severe health problems in the corrective form. The problem with marijuana is I don't want a society of stoned people that are lethargic and have problems with it. So I have a Dr. Pye with me, and we're going to discuss this because they've re-engineered the seed to separate the THC, the part that makes you high, from one of the most beneficial things in nature, the CBD. So, Dr. Pye, thank you for being with us.
Thank you for allowing me to speak today.
Well, you're a medical doctor, and you've been involved in the research with CBD and coming from
Correct.
hemp. And, in fact, what I've seen on YouTube, if a person was high on marijuana with high levels of THC, they could take this, and this would actually bring them out of their stupor, their high state, correct?
Yeah, in fact, there is some studies that were showing just that, whether someone had an overdose, say, with THC coming from marijuana, and we'll talk about that in cannabis, and when they gave just a high enough dose of CBD, it would actually almost reverse the effects of the high. And it still had independent aspects in terms of health benefits. So it's not just the opposite or the antagonist of the THC, but it also seemed to have a protective mechanism to lower the THC effect in that patients. So it lowered their high and actually provided them other health benefits.
Well, how long have you been involved in doing this research, first of all?
Well, we've been using medical cannabis in our practice for about 3 years. Once our state allowed, we have a Care and Compassion Act for certain patients that have conditions like MS or chronic pain, or more particularly in my practice, cancer patients. But I was very unhappy with the aspects of still using cannabis in terms of the THC components, until more recently in the last few years, where we started seeing research that the CBDs, or the cannabidiols, which is the health part of the plant, now has another source, which we used to use in the United States in the early 19th century, called hemp. And there's a lot of misunderstanding between hemp and cannabis, and really what they are is marijuana and hemp are different varieties of the same species. So that is like they're twins from the same family, but they act very differently.
See, I didn't know that. I thought hemp was the broad term, and that there was some hemp with higher levels of THC. But I thought hemp was the family.
So basically, think of like two twins being born from the same mom. So they have the same family name, for example, but one of them says a little bit one that's a little bit rowdier, or a little bit stoned, or a little bit funny, and the other one's a little bit more calm and relaxed and focused. And so that's the difference. So it looks very similar in cultivation, and a lot of people used to kind of grow it almost together, but they're two different values in terms of, one, the medical cannabis, or the marijuana that people are more familiar with, has high amounts of THC and low amounts of CBD, whereas hemp has high amounts of CBD and virtually traces to none of the THC component.
Yeah, and that is going to be, you're going to see it. We're going to do a series of shows, folks, and you're going to see how important that is to be able to have the CBD without the, I consider, negative effect. I know a lot of people that like to get high on marijuana may disagree with me on that, but I consider it a negative effect, the THC part of it. Now, I want to give people a little bit of background. You're the head of integrative medicine at a hospital in New York, or integrative hospital in New Mexico. Is that right?
It's actually the Integrative Medicine Health and Lifestyle Center here in Albuquerque, New Mexico, correct. I've been doing this for about 14 years, and my specialty is looking at things that are triggering inflammatory processes in patients, changing their lifestyle and diet, and using natural therapies, evidence-based-wise, to provide them safe, natural, clinical, and effective outcomes and reduce the amount of side effects, or sometimes reduce the amount of toxic therapies that we might be giving from conventional approaches.
Well, speaking of that, inflammation is considered the underlying cause of most major diseases now. There's at least a correlation, and in some reasons a cause. I just read a few days ago that the C-reactive protein is not only a reading inflammation, but actually a cause, at least in some cases. But how does the CBD, the cannabinol, benefit inflammation?
Well, it's very interesting that there's a variety of mechanisms that are currently been studied. First and foremost, it does block something called NF-kappa beta, and that's one of the major, we call it major inflammatory immunological switches. So just think of one major switch or a pipeline, and once you open up that pipeline, then the flood of water can go to smaller sprinkler sets. And NF-kappa beta is one of the larger, we call it major inflammatory markers or immunological switches, and NF-kappa beta has been shown to be blocked by the cannabidiols. But not only that, it has an immunological benefit where it actually helps improve certain white cells in the body or certain blood cells in the body that help also control inflammation. So it's not just a single pathway, but what we're looking at in the literature is kind of a multi-prong approach of different mechanisms of inflammation, whether it's actually from a cell or from a pathway. It's helping kind of modify those.
Does it turn down the inflammatory cytokines and the interleukin-6? Is that what I know?
Absolutely. And in fact, there's actually some research that's been showing that very specifically, because we're looking at chronic inflammatory diseases. And as you mentioned before, inflammation triggering most of these disease conditions to get worse. So any disease that has the word itis, I-T-I-S, just means inflammation of that area. So someone says arthritis is inflammation of the joints. Someone that has colitis, inflammation of the colon. Someone that has dermatitis, inflammation of their skin. And so we have about 200 different itises now in conventional medicine that has been diagnosed. But we want to look at is what can we give kind of from a systemic standpoint, meaning an all-over, holistic approach that will calm all these little fires in the body versus just giving a targeted pharmacotherapy that might have side effects because it is so specific.
Okay, and I'm going to talk to you more in the near future on this, and we're going to do a series of shows because people need to know, is there good forms of CBD, not so good, a number of different things, and also people will be able to find out where they can get these good forms. So I thank you, Dr. Pai, for being with us and just helping us start this educational process. Very important for my listeners. Thank you very much.